Welcome to the Shops at the Shop, a workshop and orientation for barbers and stylists. I'm Omar Neal. I'll be serving as your master of ceremonies and the moderator and facilitator today. I'm the former mayor of Tuskegee, Alabama, as well as syndicated talk show host of the You Got the Power show. And I'm elated to have each of you here. We're going to have a conversation about vaccine hesitancy, what we're hearing in the shops, from the barbershops to the salons, and how we can navigate the conversation where it is constructive and that people can get the proper information so that they can gravitate to take care of themselves. I'm joined with my sidekick, Dr. T, Dr. Stephen Thomas. Hey, Dr. T, how you doing, man?
Hey, Omar, you know what? It is always great to see you, my brother.
Well,
So I'm Dr. Stephen Thomas, Professor of Health Policy and Management at the University of Maryland School of Public Health, where I direct the Maryland Center for Health Equity. And one of the initiatives that we had launched, you ready for this? 15 years ago, was called HAIR, Health Advocates in Reach and Research, bringing health information to barbershops and beauty salons focused on those chronic diseases. And we're just moving along as best we can, and COVID hits. And it was very clear when they talked about those underlying conditions, those were all the things we were dealing with in the barbershops and salons. And we said, could this be an opportunity to pivot and bring a focus on making sure that barbershops and salons were safe, and that the barbers were safe and that their clients were safe as we were dealing with COVID? Remember back in the days when people couldn't get access to the vaccine? Amazing. Look at us now. Now we got access to the vaccine and we got people at the hell no wall. You know what that wall is.
yeah,
Saying
absolutely.
hell no for no reason.
Right.
We did the very first COVID vaccine clinic in a barbershop in May. And I got the attention of the White House that was watching some of the things we were doing even beforehand. Long story short, our little model has grown up to be the national campaign. And so we now have an online training program for all of you to participate in. And that is the humble origins of Shots at the Shop. As of yesterday, 939 barbershops and salons from across the United States have signed up. This is amazing. So welcome. Tonight is an orientation training. We're going to walk you through step by step how you kind of meet the guidelines for our partner, Shea Moisture, that has put $1 million on the table to provide a $1,000 mini grant to all the barbershops and salons that complete the training and host a vaccine activity. So, Omar, what an amazing opportunity to get our barbers and stylists recognized for the wonderful work they do,
Right.
because they are truly trusted information centers.
Absolutely. And certainly we are doing this. And let first kudos to Shea Moisture for putting up the money to do this, because it's not about paying you. We certainly can't pay you, but we do respect your time. And we are appreciative that they respect your time as well. And so that's what this is about. Well, Dr. T, I want to do something that we normally start out with, is to get kind of a feel for where people are. And so what we want to do is put up, I see I have Ashley has joined me, us now. And hey, Ashley, how are you doing?
Hi, I'm great. How are you?
Fabulous, wonderful, wonderful. So we got everybody that's in the house. Now, let me, before we get started, I want to tell you all who's with us today. Because I have a special program. I didn't know it would be this special, but after I thought about all the people here, everybody here is very, very special to me. You have Dr. Christopher Blair, who is the superintendent of the Bullitt County School District in Alabama. We have Dr. Dina Winston, pediatrician. in Montgomery, Alabama. And let me say this, she's the pediatrician for my daughter, my only child. In fact, let me say, maybe a day or two, I don't know how many days after she was born, we took her to Dr. Winston's office, and Dr. Winston gave her her first shot that I saw or was there for. And I had to trust Dr. Winston with my only child to give her a shot. And so it tells you, this whole trust factor. But she was the first, and up until her adulthood, Dr. Winston was her doctor. And so we are so happy to have her. And then Felicia Salary Barrow. She is like a sister from another mother. I mean, she's very, very close to me. We've worked on multiple projects over the years. She's working with the Alabama Public Health Service now department. And she's going to be heading up the same thing that you do at the University of Maryland, health disparity issues and that kind of thing for the state of Alabama. And last, but certainly not least on my end, we have Ms. Ashley Gomez, who is the founder and president, CEO of Impressions of Beauty. And my daughter works with her. So, so you see how all of this got to come together. And what they do is they work with young ladies, college age, primarily in dealing with self-esteem, beauty, character development, and all of that on college campuses. Over 40 HBCUs, that's historically like colleges and universities around the country, they work with them. And so what a wonderful thing. Now, I just met today Kim Stinchcomb, who is hanging out with us as well. And so what I'm going to do...
she comes from my neck of the woods, Omar.
Yeah, I know. That's why I wanted to let you introduce Kim to the group, since I got a chance to really lay out my family too. Okay.
And I just love the it's all about the relationships.
Absolutely.
When that phone call comes in. And I made that phone call to our leaders here in Prince George's County, Maryland. This county has 1 million people. 65% of the population self-identifies as Black. Another 20% Hispanic or other immigrant group. So imagine a county that's majority minority already, okay? It's an amazing place. And so Kim Sitcomb is here with us. She is the training and exercise coordinator for public health emergency preparedness and programs. And this is why the pediatricians and the superintendents of schools need guidance from the emergency preparedness leaders. And so Kim, welcome to our webinar today.
Well, Doc, I want to know how people are feeling. So what I want to do is, if we can put up our word cloud and kind of see what emotions people are going through today. I want to kind of see what that is as we begin to engage in the conversation. Now, do know this.
So do this, people who are listening. In the chat is a link, and that link will take you to the cloud. Go ahead, Omar.
Right. So what we want to do is we want to see what the cloud looks like to see where people are. But I want this to be conversational. This is not a quiz. We're not on the regular shows and that people are trying to pontificate. We're not doing it, right? What I want to do is I want to have the conversation. And I want to start out with you, Dr. Christopher Blair. You've been on the You Got the Power show multiple times. You are superintendent. You're getting ready to open up your schools, right? And so I want to know, what are your challenges as you see them? What are you hearing? What are the hesitations or reservations or equivocations that people are expressing to you? And what do you believe we can do as a country to address those critical issues?
Good evening. Thank you, Mayor Neal and Dr. Thomas. I really appreciate the opportunity to share from the aspect of being a sitting school superintendent. I've been in my role as a superintendent for 4 years, and it's been very challenging for the last 16, 17 months, and you all know why. And what we're mainly dealing with now is it's still a lot of fear and hesitancy around contracting COVID. How do you spread COVID? There's still a lot of concerns around children being in the building near each other, right? Using the drinking fountains, touching other items. And now there's a lot of fear of the new variant, the Delta variant that people don't understand as well. Hearing the information around it's more contagious or it's more deadly. And with that, a lot of our parents are still, after coming off of summer school, which we have offered 6 weeks of summer school, this is our last week. And we've had very successful programming for the children that did enter summer school. But leading into that reopening for summer school, some of those same concerns existed where parents couldn't trust that the school system would do its very best to mitigate COVID with all of its protocols in terms of masking and temperature checking and surveillancing, spacing of children, keeping their items separate as much as we possibly could, but also testing. My district, since the month of December 2020, we have consistently issued monthly COVID testing for our staff. So we do surveillance tests. And also we've had vaccination clinics for our staff, as well as we've been a part of our community vaccination clinics, encouraging students. So there's still a lot of fear and hesitancy, but with it, there's still a lot of apprehension around getting vaccinated simply because of the rumor mills of what a vaccination would do. I've heard everything from computer program your brain to now track you and, you know, turn you into a zombie. I'm hearing this from adults, right? Not just from some of the children that are watching sci-fi or, you know, other YouTube videos, but adults are believing this. Matter of fact, one of my great fraternity brothers, he's like a brother to me. We've been brothers for 30 years. He today told me he still doesn't believe the vaccine will work, right? And this is a trained doctor of physical therapy who deals with vaccinations and medicine, everything in his career, but he is one who does not believe the science. So not only is it the educated who are in the medical field, but it's also just my parents who are in the community working, part of the essential working pool, or even some of my teachers. So there's just still a lot of hesitancy, and it's because of history and because of our last political environment that has just polarized vaccinations and this sense of independence versus public health, which we've always been in the business as a school system of ensuring that all persons in the district are healthy, including the children and our adults as we interact to provide them this school. So on the gamut, we're still hearing fear, but also a lot of some parents are excited about vaccinations and they've gotten their children vaccinated, which we're excited about, but it's still a mixture. And I think the messaging, getting vaccinated, what can we do more of people who are, such as ourselves, vaccinated, and why do we get vaccinated? Telling that message and encouraging others, you know, giving the good, the bad, and the ugly about the vaccination. Were you sore? Were you sick? Whatever happened, you know, being truthful about it so people can see there is a level of transparency when it comes to what I personally experienced with the vaccination, or if I was a person who had COVID and then ended up vaccinated. But the whole, what can we do? I think is still having a stronger message from the people who are vaccinated to encourage those who may not be.
So Superintendent Blair, you had a number of very powerful words, and all of the panelists, you can go in that chat and also add words, one word at a time, but as many words as that you come up. We only had 4, so we're just giving instructions to get that cloud going. And then we'll Omar, I'll let you be the one to say, let's see the cloud and we can watch it grow.
All right. Well, keep me posted as to how the cloud is developing and what time that we need to kind of put it up there. But I want to go to Dr. Winston, because Dr. Winston, I don't recall what you said to us, but when we brought our daughter to you for the first time, your bedside manner, the way that you talked to us gave us comfort. We knew that we were placing our daughter in really great hands. And so you told us that we had to give her a shot. This was the first time, I think it was the first time. And we, I don't know how we asked the question, what was it about, but we felt comfortable that you knew that what you were doing and that it was in the best interest of our child. Why have we moved away from that?
That's a great question, Mayor Neal. I think, at least in my career, especially in the last, say, 5 to 6 years, there's just developed an overall mistrust in not only, the environment as a whole, but in the medical field as a whole.
Mhm.
I see it in the office. Parents have um, lots of irrational questions. They come in already with sort of a preconceived notion about what they want. Um, they aren't very accepting of your expertise. Um, I think Google Doc has gotten a lot of us in trouble. There are lots of places to access information that um, may or may not be correct or valid or research based. And so they come with many more questions, and some of them already have a belief system in place when they come to you. So there's a breakdown in the trust. Um, Even with providers that you've chosen, there's a breakdown. Um, I think, in the office, I try to um, present parents with information, but also listen to their concerns and try to address their concerns. Oftentimes they're accepting of it, oftentimes they're not. Um, so I think there's just an overall breakdown.
Are you okay?
Yes?
No, that's somebody that's in fact, everybody is not on the panel. Let's go on and mute them, and so that we can do that for everybody in the back office. Thank you. Go ahead, Doc. So it's like people getting information from everywhere else, so they are really not trusting the professionals because they're getting so much information from the social media and all of that. Is what you're saying?
Right. Correct.
Wow. So that's a problem. Yeah, Felicia, Ms. Barrow, I'm hearing that the greatest threat to vaccine uptake now is misinformation. Is that people are not really given the proper information. Is that what you all are seeing at the Alabama Public Health Service as well?
Yeah, you can unmute.
You can unmute. See you unmute. See where it is. Can we unmute her? Do you see where it says unmute in the bottom?
So let's do this. We can cycle back.
Yeah, I'll cycle back. Well, let me say this. Ms. Gomez, you are dealing with young people, and you just did a survey, right? A poll. And tell us about what the poll said and what you are hearing from the college students that you all are dealing with. No, first thing I want to do, tell me about impressions of you. I want people to know about, because I'm really proud of what you do, right? So tell us about this wonderful concept of what you're doing. I really want people to know what you're doing first.
Awesome. Well, thank you first off for having me, you and Dr. Thomas. I really appreciate you for including me in this. And I'm so honored to be a part of this awesome panel. But yes, Impressions of Beauty, we are a college marketing agency who does a lot of work on multicultural college campuses. So we focus a lot on HBCUs, and we go to these campuses and we share various beauty products, beauty brands. But our true messaging and our true ministry is that we really want to make sure that college women and college students are equipped to be beautiful from the inside out. So as you mentioned, we have a lot of philanthropic efforts that we do through our company. We have traveled to pretty much all of the major HBCUs, you name it. We have some programming that we've done there. We have scholarship offerings, internship programs. We also have an influencer program, and we just really try to do our best to create creative programmings on multicultural college campuses, but then also just make sure that these young ladies are equipped to be successful starting at their college career. So love what we do. And again, we're so honored to be here and to represent them on this panel. But in terms of what we're hearing, we actually, like you mentioned, we did a poll earlier this week when you invited me, and I just wanted to really make sure that we had our finger on the pulse. And my guess was that the poll was going to say, maybe 60-40 were vaccinated, 60 being unvaccinated, 40 being vaccinated. And we actually found that from the poll, about 80% of them actually said that they were vaccinated, which was surprising. It was also, great information for us to see and to hear. But I think that the 20%, what we're hearing is, I think, three things. So one is a lack of trust. So I think historically it's kind of, what everybody has already spoken about, Mr. Blair, Dr. Winston, that there's just a lack of trust. There's a lot of misinformation out there. People are believing it and they're choosing, not to get vaccinated. I think the second thing is that we're talking about Gen Z people or students, right? And they have a totally different mentality than probably most of us on this panel. So they kind of feel like they're invincible, right? So all the research, all the data, everything was talking about, it really affects older people. It's not really affecting young people. If young people get it, they'll, maybe have a cough or be down for a day, but they're not going to die from it. So I think that they feel like, well, even if I got it, I'm not going to die from it. So it's fine. If I get it, I'll get it, I'll get over it, I'll be better, and I'll be back out doing whatever I want to do, a week later. So I think that that's the other piece. And I think that third piece is that this generation also, they have a different approach to medicine. And Dr. Winston, I would love to hear your feedback on this, but they have a different approach to medicine in that, they are not huge proponents of going to the doctor all the time or taking the medicine. They would rather, the natural, supplements and things like that. So my brother, he is turning 30 this year. He's not vaccinated. I just had a pretty intense conversation with him last night about this. And it's like, I'm taking oil of oregano. I'm doing this. I take my vitamin C every day. I've been doing everything. I went to the Super Bowl. I went to this. I didn't get sick, did I? And it's almost like this Russian roulette, like the bullet didn't hit me, kind of like trying to prove a point. So I think that we're just kind of dealing with a different beast. And as you and I have talked about, I think it may be, this is definitely a harder audience to tap into and to convince for those who are not already on the train. So I think that's kind of good and bad. So we are seeing that people are vaccinated or getting vaccinated, but the ones who aren't, I think that they are definitely going to be what my mom would have called hard-headed. So we are going to have to work really hard on them, but that's where we are. So.
My mom used that same word on me.
Everybody got the same mother.
Hard-headed.
But hard head make us softly somewhere.
Okay, yeah, that's right.
Yeah. That's the other part of that. Felicia Salary Barrel, I see you're ready to talk to me now. We're talking about, you all deal with public health. So you're trying to, make sure that everybody in the state of Alabama is healthy. That's your goal. Right? But when you find that the greatest barrier to getting people vaccinated is not the availability of the vaccine, it's none of those things. It's really misinformation, disinformation. It's people telling people things that are not true. Is that what you're hearing? And if so, well, how do you combat that?
Absolutely. And this is a day-to-day struggle for us as public health employees. We receive the calls, we participate on the Zoom sessions to try and address concerns. We don't want to call them myths because we respect the concerns that people have. But you're correct in that we're combating a lot of disinformation. We have experienced physicians, medical professionals on social media that are putting a lot of things out there that are simply untrue. Slow
down. Say that again slowly.
Okay.
Medical professionals?
Medical professionals. Our chief medical officer, Dr. Mary McIntyre, tries to stay abreast of all of those things that are just swirling out there in social media. And there is a site, and they are medical professionals. They have a pretty large following. That is what concerns us the most. But we continue to talk. We have to continue having the discussions. You know, of course, we have to do our due diligence as, you know, a public health agency to protect the public. So we, you know, we put on our vaccine clinics, we partner, you know, partner with the community, we partner with the Alabama National Guard, FEMA, all of these entities to help us reach the people in the community and, you know, do the vaccinations. But we also have to listen. There are a lot of staff at public health that have not been vaccinated. And when we ask the question, it's, you know, they're in a wait and see mode. I want to wait about a year to see what happens to the person in the cubicle next to me. And if nothing happens to them, then I'll go get the vaccine. So, you know, we try to put the information out there, educate as much as possible, show up wherever they ask us to. So, you know, it's very difficult. We're in a difficult season. We're dealing with a lot of antagonists out there, and it's a challenge, but we have to keep at it. We can't give up. And so, you know, that's what we do day to day. We just keep it moving, keep educating.
You have a new role too that you're moving into with the. They were telling me about you. They were very excited to have you at the Alabama Department of Health. Tell us about your new role that you're moving into.
Well, the Alabama Department of Public Health has always had an Office of Minority Health, but we are revamping the former Office of Minority Health, and it will be the Office of Health Equity and Minority Health. So we are going to look at not only the data, the quantitative data that we see, we want to know the why behind the data. So we're going to have more of a presence in the community. We will utilize the community health worker model. And we hope to bridge that gap between the community and public health and look at health disparities as a whole. And if there are wraparound services that are needed in the community, we want to provide those services. So we're excited about it. We are in the initial stages. We have just received our CDC funding for our health disparity grant. They have provided the state with 42 million, a little over 42 million. So we have many partners that will be boots on the ground to assist us in kicking off this Office of Health Equity. So we're really excited. We will be engaging policymakers and all stakeholders throughout the state.
I think we need to give her some snaps, man.
Absolutely,
those are serious dollars.
And she's, I mean, I'm telling you, she's a superstar. I tell her that all the time. So I'm not just saying it's not hyperbole. Right?
And I pay him later. Him later.
Kim Sitcom, tell us about what's happening up there in Prince George County. I mean, and how do you see this thing? I mean, it's hard stuff. It really is. What are you seeing? And what approach do you think we need to take to really move the needle? Because, you know, when the virus is just looking for some place that's vulnerable, it's looking for a vulnerable target, right? So it doesn't care about your political affiliation or your color or your ethnicity or your sexual orientation. It doesn't care about any of that, right? So what are you hearing and what do you think we need to be doing to try to move the needle?
Yes, so the virus doesn't care. It does care if you've been vaccinated because that is your defense. But what we've really been seeing recently is that in Prince George's County, Maryland, we've actually been very successful with the vaccine effort so far. After a slow start, we've made really great moves. towards vaccinating. We are up to about 70% of our adult population. And so it's been really successful. So part of the issues that we're hearing right now is, well, from those people that are undecided or maybe unsure is, well, we've started reaching our goals. 70% was the president's goal. So why get vaccinated now? Everything's reopened. Why do I need to get vaccinated now? So we're trying to remind people, first of all, that it's not over, that we're still in this, that new variants are coming out that we need to protect everyone from, that a lot of I think 100% of the deaths from COVID in the state have been from those that are unvaccinated. And I think a large majority of the hospitalizations have been from those that have been unvaccinated that have gotten COVID. So what we've been doing to try to address that and those that aren't vaccinated in the county is to remove any remaining barriers. So people that are unsure are not going to go out of their way to get the vaccine somewhere. They're not going to take off work. So we've been trying to use our mobile units to make the vaccine available where you live, where you work, where you pray, where you get your hair cut, and make sure that people don't have any additional barriers. So we've done a lot of efforts in our mobile units at where we're doing a faith-based effort right now. We're also doing a school-based clinic effort. We have a clinic going on right after school hours. We finished up at the end of the school year, and now we're focusing our community-based clinics at the schools as well, because that's where the youth feel comfortable, that's where they feel safe, and that's where they're used to seeing people that they know. So that's a really, it's been a very successful effort for our young groups. And then we're also doing an apartment-based clinic effort, and that has been extremely successful. We get a lot of input from the site managers and the facilities managers to help reach out to the community and build them up. And it's right there when they get home from work or when they get home from, whatever school activities that they have. And making it convenient has been key. And it gives us an opportunity to have a little bit more intimacy with the people that are there and answer any questions instead of when we were in more of the mass vaccination status where everybody's kind of getting pushed through a line. So if anyone has questions, that they have the opportunity to ask them.
That's powerful. Ms. Gomez had a statement, and I want to go back to that statement. She says that young people are kind of looking at medicine differently. I think, Dr. Winston, you may have even alluded to that, and that is that if I can have my immune system is good. I've heard people tell me that, right? And so Dr. Winston, I want you to help me with that conversation. Your immune system is good. Are you still vulnerable and susceptible to contracting COVID and getting seriously ill and even dying?
Yes, COVID has no, it knows no barriers. COVID doesn't care if you are ill. It doesn't care if you're well. It doesn't care if you're young. It doesn't care if you're old. In particular, in most situations, young, healthy people are less likely to get severely ill, but they are not immune from severe illness. As the older population has gotten vaccinated, of course, now the numbers are shifting to the younger people because those are the people that are the most vulnerable. Those are the people that don't have the vaccination on board to fight this horrific virus. One of your guests here today mentioned that some of the younger people, of course, think they're not, they're immortal, they're not vulnerable to the vaccine. They'll take their multivitamins. What I say to that is, yes, take your multivitamins, take your oregano, take your vitamin D, take all of those things, but look at what the science is telling you as well. And get the vaccine. Let's listen to Western medicine as well as, the all natural sources of medical treatments or other options that are out there. I say do them both. Do them both.
what's interesting is, and I think that Dr. Blair may have said it as well. A lot of times people live in their little silos, and they get information from Pookie.
Pookie's my cousin now. Come on.
Yeah, I know Pookie's your cousin. That's why I said it, right? And so they will take Pookie's knowledge over Dr. Winston. Now she spent all of this time in medicine, and they will opt to follow Pookie than Dr. Winston. And Dr. Blair, we're gonna do that. First, I want you to come back. I want you to think about how peer influence, right, has a big handle on this thing. And we're gonna figure out how we can use peer influence. And Ms. Gomez, you that's what you all do, right? How do we use peer influence to change this? I believe that young ladies can get young men to do anything they want them to do, right? Right? I just got that feeling. And Andre, I see you laughing, so you know I'm telling the truth, right? Right? So maybe we can come up with a campaign, right? Right? And we're gonna talk about it, right? All right, so let's go to the word cloud. I want to see what people are thinking out there on the word cloud. So if I can get the word cloud up.
And on this word cloud, yeah, Omar, this is what the people out there are saying. And you can keep adding. I think that the link is still there. But look at what the audience
motivated is the largest one. And let me tell you how this is done.
Yeah.
The people who put whatever word goes in the most, that word comes up the largest. So look at encouraged, motivated, overwhelmed, which is one, apprehensive, unsure, inspiring, creative, fatigue, intentional, listening, protected, joy, hopeful, ready, excited, empowered, relieved. And so that's what we got up there now. And of course, you can continue to put your words up so we can see what you are feeling. Find out kind of a consensus of emotions that we are experiencing as a part of this group. Dr. Blair, while we're doing that, tell me, you got peer influence. So it's not just the message, it's the messenger as well. Is that true?
It is. And, when we say peer influence, I think a lot of what's happening in my school district particularly is the messaging that's coming from some of my staff and, their influence on the families. It's similar to what I just heard Felicia Barrow speak to when she said that if you have a Department of Public Health and the persons who work for the Department of Public Health aren't, the high percentages of vaccination aren't there, then that's an issue. So what we're finding is that the students, and we just had we had a recent event in the community that was a COVID block party.
Yes.
Can you hear me?
I ain't listening.
Hold on one second. There's somebody that has your
the crew will mic him. We'll mute them.
Yeah.
Those are points that I'm making to you.
Staff.
Crew. Let's make
sure. Can you hear me? I think I'm getting the background. But what I'm saying is that we had a clinic, and what I saw was a lot of teenagers at our vaccination clinic for the community. And that was encouraging to me. And the messaging, which we're not directly vaccinating teens or 12 and up in our district, but that peer influence of these students who are vaccinated that are preparing to come to school. That's the influence that I want to be able to tap into. How do we get those students who are school age, 12 to 18 or 19, that are still in our public school systems or my K-12, how do they spread the word to other teenagers, the importance? Because for those students, and I have a daughter in my home, she wants to make sure she's vaccinated so that when she returns to school, she's safe for herself and other people. And that's the messaging. And Mayor Neal, when I hear you say the peer influence from the staffing, influence on how we are talking to each other about vaccinations and to our parents, but also how teens and this underserved population, how they're talking to one another about the vaccination from a positive standpoint is a energy we need to tap into.
you know, Ms. Gomez, you all are in marketing. I know you all do a lot of things, but you really in marketing, right? I mean, that's what you all do. You all market to people. So you develop strategies for marketing, right? Because you know that's how you frame the issue, determine who embrace the cause, right? Right. So have we thought about something like, you know, let me just throw something out. Why don't you do something like promote your protection? You know what I mean? As a campaign, right? And we do TikTok, and people can do their own little dance that I'm vaccinated. Why not you? You know, vaccinate. We can do this.
Wait a minute, we got a job opening. You looking for something?
My daughter's already there. I mean, so
promote your protection.
I like that.
PYP.
Your protection, right?
I like it. I like it.
You know, and that wouldn't that be wonderful to go through your organization and your group and promote and get the people like what's happening with Ms. Barrow. Get the public health people involved, and Dr. Winston, you all can come up with your little TikTok. You can dance a little bit. I know you can dance. You got daughter, right? Dr. Blair, you can dance too. I mean, you can come up with something, have the teachers, that's what I'm talking about. And if they come, we can do some things there too, right? Up in Prince George County, right? Why don't we do that and just do a whole nation, talking about, I think people need to see real people saying, I did it and I'm out and I'm okay.
Yeah. Very important.
Right. And I think we need to, because if the misinformation, disinformation is the most dominant, then it will prevail. So we have to counter that with other information more vigorous than the disinformation. Right. And that's what we need to do.
And Mr. Mayor, in the barbershops and salons, all kind of conversations happen. And those places can either be places of spreading conspiracy theories or places where you can get accurate information for people to make informed decisions. And this cloud encourages me because these are the barbers and stylists out there telling us they're motivated, they're encouraged, they're a bit overwhelmed, like we all are going through this. But they can't do their jobs 6 feet away. So we've got to make sure that as we move into this next phase, you might start hearing this word endemic. It's like, we're not going to close the whole country down again, but now we have an outbreak in a certain county, in a state, or in a certain neighborhood. And so there's the danger when it becomes endemic, because everybody else is going to be acting like mission accomplished. This Delta variant is nothing to play with. It is actually more infectious and more dangerous than the one that came before it. And this is why we want to redouble our efforts to get as many barbershops and salons on board and with a clinical partner, so they too can make sure their clients are safe and that they're safe. And Superintendent Blair, we're getting ready for back to school, and most barbershops and salons have a free haircut back to school event. We can build on that.
Or I wonder too, teenagers, of course, are very susceptible to peer pressure. I've had in the last 48 hours 2 conversations with teenagers trying to convince them to get the vaccine, and they had all this misinformation from friends. I know.
Okay, go ahead, Dr. Winston.
So, Dr. Winston, you're muted.
You're
unmute yourself.
There you go. Okay.
There you go.
I was saying in the last couple of days, I've had 2 very long, detailed conversations with 2 different young teenagers who were vaccine hesitant because of information they had gotten from friends. And I wonder if maybe we could start some kind of initiative where vaccinated teens bring another teen to get vaccinated. They're very, very, very susceptible to peer pressure. And that's one angle. Also, I wish we could better educate our ministers in our churches, because one of the girls in particular was getting information from her friend whose pastor had told them not to get it. So she was getting misinformation from her church. It's very difficult, even now for me as her physician, to talk her into getting this vaccine when all the information around her is telling her not to. But maybe we could do like a get one, bring one type of phenomenon where the barbershop is nice, but something that is young people oriented, and a teenager bring another friend to get vaccinated. So it's kind of, get one, teach one, or get
like
one,
that.
bring one.
Playing off of the, what is it? Friends don't let friends drive drunk. Friends
Right.
don't let friends go
Absolutely.
unvaccinated.
Same thing.
Yes, there you go.
Right.
And
You know,
Ashley,
one thing that I want to say, and I keep going back to Ms. Gomez, but let me say this. Do people think about, well, okay, not just for me, but I'm a part of a family, I'm a part of a community. And so I'm not just doing it for me, I'm doing it for somebody else. And let me give you a case in point. I've had a family member who went to Florida, went partying, came home. His mother gave his mother COVID, and his mother died. All right. Had another situation where a friend went out, gave it to her husband. She lived, he died. So is it something that we can do to get people to see the interrelationship and the interdependency that we have with each other? So it's not just about me. To say I'm not getting the vaccine, but that's the reason why only, and not taking into consideration how it may impact someone else, I think is selfish too. Is that wrong for me to say? And I'm going to just open that up to everybody. You all can open up this is conversational now, not going to necessarily.
yeah, you can unmute
Just
yourself.
everybody unmic.
The panel.
Just the panel unmic.
I've also tried to express that to my patients, that, you're not only doing it for yourself, we're trying to protect our community. I heard a statistic the other day in a webinar that I was listening to, that if we were all able to get vaccinated, this would be gone in 30 days. But because we're doing this in stages, this pandemic will linger and the germ will change. And, in 6 months, it may not be as sensitive to the vaccines that we have. So we need to encourage a person's source or feeling of community. I oftentimes get my moms that don't want to get vaccinated because their kids can't get vaccinated. And so they don't want to protect themselves because they figure, well, if my kid dies, I'm going to die too. And I'll be honest, I had that same feeling when I was able to get the vaccine as a healthcare provider, but my family was not. I thought twice about it. I thought, well, I don't want to get it if my girls can't get it.
Right.
So there's that angle as well of people kind of being hesitant because they can't vaccinate their whole family. So maybe as we see the younger age groups available to receive the vaccine, we may see some of that type hesitancy go away.
Right. Ms. Gomez, when you were talking to your brother, did he listen to you? I mean, because brothers, siblings, they got their own thing anyway. They argue and do all of that anyway. How was he responding to you when you were trying to get him to understand that it's for his good?
Well, he is one who, he's got his mind made up. He's very strong-willed, but I was just going to say, to your point, Dr. Winston, his thing is, he is a single bachelor. He lives by himself, and that's his thing. Now, if I had a family or, if I lived with people, then maybe I would, but why do I need to get vaccinated? This is just me. This is my thought, my body. This is what I'm going to do. And there's nobody else that I'm affecting. And now he does go out into the community. So that is a false statement, but that's his thought. So
Yeah.
He has a family, right? You got to think about you all as his family.
He has to think about you guys as his family, right? And his
Yeah, and I
mother.
think, during the pandemic, so he lives in Atlanta where I live, and he didn't really come around much during the pandemic because he was being mindful. Like I do, I respect your thoughts and I respect my thoughts. So, let's just keep our distance so that, if I am infected, I don't infect you. And, every time he went home to visit my parents, he would get a COVID test beforehand.
Okay.
But I think
At
he's
least
being,
he was that conscious. I mean, that was cool. Yeah, he was that.
yeah.
Yeah. We're at this point where we can't use the same tactics. We got to come up with new strategies, right? We got to throw away the box. We can't just think out of the box. Let's just throw the box away, right? And let's figure out how we're going to do this, because this is at a critical space. Now, I do know we have people on who are at various phases and stages of your completion of our program, and so we're going to bring on Sebastian at some point so that he can kind of help people go through some things. But I want to know if there are any questions from any of the barbers or stylists. Andre, you can ask the question.
Well, yes, we just finished. Matter of fact, I just got back from one of the shops.
Tell them about your shop, Andre.
This is a shop that's inside the mall, North DeKalb Mall, in DeKalb County, and I've talked to Dr. T. He was involved with us today because we got some static from the health department, but I have nothing negative to say. However, they now want us to do one at our location in the airport in Atlanta. But some of the things that we experienced today, you guys know that I'm a novice in this program, but we found that a lot of people decided that when they came in groups, they wanted to sit and wait to see what happened with the person that actually got the vaccination. And so there's nothing we could do to, make that go faster. And then we also had a few people that said, what? They only wanted the one shot. They wanted the one shot. And we were committed with the health department, the Johnson & Johnson. However, they didn't bring it. So, and it's not, there's nothing negative to say about what was going on today. However, there was a planning aspect of this where I had discussed this with these people earlier this week, and they were supposed to bring all three, and then they didn't because they had reasons that made no sense to me, but because they were trying to put it off. And I had to involve Dr. T with the director of the health department here in this county. And I have to say, whatever he did, he made this happen and it came off today. We had a whole bunch of things going on. You guys are an influence to any barber that's trying to do something here and they run into obstacles. I cannot state it any more enthusiastically that we need to also include you when we have obstacles. And Mayor O'Neill, Omar,
yeah,
you look good. You don't have to hide behind that mic.
Thank you. Let me say this. That's what our work is.
Yeah.
But, Ms. Barrett.
Well, I was going to say, not to cut you off, because I know you guys got to hurry up and get finished.
Yeah.
But we had the seniors coming from a house, and all the seniors wanted the one shot. So they didn't have it. They had to send off for it. So we had a bus full of seniors. They decided to go to Golden Corral. But of course, after they ate, they didn't come back.
The other thing is too, there are a lot of people who've gotten one shot of the Moderna and the Pfizer, but didn't get the second shot. they are not as protected. And I think we need to really go back and circle back while we have time to really influence those people. That needs to be a strategy in and of itself. So we got multiple layers.
Right, because, you know, it was trying to be explained to them, but of course the seniors, so all of them did get off the bus.
Right.
You know, yeah, so
Mr.
whatever there was nothing we could do because they didn't get off the bus. We couldn't explain anything to them.
Yeah, right. And that's but we can't stop. The other thing is we cannot get weary and well doing. That's the first thing. I want everybody to understand that we got to be in this for the long haul.
Right.
Aaron, say a little something. I see you there, man. I just want you to say a little something about what
Sorry
you all
about
are doing up there as well.
Yeah,
Thank you, Dr. T.
Oh.
Thanks, Andre.
Okay, yeah, thank you guys. And Dr. Blair, just this is actually more directed to you, but we are in the process. We have 2 health clinics in our barbershops in Madison and Sun Prairie, Wisconsin, but we are now transitioning to sports physicals. And talking to our athletes, they're actually now going to be a part of letting the community know we don't want you coming to our games if you're not vaccinated. And so we're working on that now. And these kids, they came up with this initiative on their own. And they're saying, you know, we're out here sweating, running up and down this court. We don't want you infecting us. And so they're utilizing that. But I was wondering with Dr. Blair, what is the parameters or the pushback that these kids can anticipate from your athletic departments?
You know, I think that's an interesting concept. I haven't heard any messaging around athletes saying that to the public, but I believe, you know, in my community, we love athletics, right? And that's an area where I think in order to have an athletic competition that doesn't look like what we had last year with limited spectators or no spectators in certain cases, I don't think athletes would get a lot of pushback because it's the respect that they're asking for their health as well as the health of the community. Because we know some events were shut down because of community issues to the athletes. So I would think that's a very interesting position to be in as an athlete who is asking for respect from the public in terms of that's overall protection. You're going to get some pushback, you know, I believe, because they may look at it as a monetary, because we know that the events themselves bring in that ticket, that revenue for our athletic programs. And if the public is not there, then you are going to miss that revenue, which for me, it would go back to the school board to support athletics without that community revenue. So you may see some monetary pushback where the athletes may push themselves down a little bit and not give that message if they feel like either the coach, the principal, or those administrative teams need that revenue. Then that messaging may get stifled a little bit because we know money changes the game in terms of just how you feel and what you think about it.
You know, Superintendent Blair, with the changes in the NCAA where they now control their own images, these kids, listen, COVID is not the flu. There are young people with long hauler disease. They could affect their entire athletic career in negative ways simply by thinking, oh, I can get through it. And that's why we have to hold the course. And what Andre went through, this is all brand new. And Omar, he's right. The phone calls that we make, the high touch phone calls to help people, definitely removes roadblocks.
You know, this is a White House initiative. People know that, right? And they should know. This is not somebody, we're not just coming off. This is sanctioned by the White House, President Joseph Biden and Vice President Kamala Harris, right? This is a White House initiative. And so, you know, we don't like to use, you know, that kind of influence. We want people to do it for the right reason, but we will not allow people to not do what they need to do because we're about saving lives. And that's what this is about. So it's not about personalities, it's about saving lives.
So one of the things that we want to do is kind of show the steps that you need to go through to get to the finish line, both getting your campaign and getting your mini grant. So what I'd like to do, Omar, is walk them through fairly quickly the steps, and these are all in the website. And then Sebastian's going to open up a breakout room for anybody who's ready and who's been having any technical difficulties. So if you don't mind, Mr. Mayor, I'll share my screen.
Okay, go ahead.
If it works.
It works.
And
Cross your fingers.
yeah, please out there, cross your fingers. All this technology, all kind of things happen. And let me take you into my world a little bit, even if I have to walk you through the sock drawer to get you there. And you know how this thing sometimes gets in the way? You're trying to click on something and it has something in front of you. Okay, Mr. Mayor, can you see?
I can see that. It's
okay.
Full screen. You're good.
Now, Meg, one of the staff, go ahead and put this link in the chat. We have updated this website to make it easier to navigate and make it even more clear about the steps that we're taking to get you to the finish line. And the first thing is to register at Shea Moisture. We're knocking on the door of 939 shops that have done that. That gets you in the door. That gets you here, because once you're here, once you register, you're able to get the listserv emails, etc. Step 2, you need to come to an orientation. Hey, you're there right now. This is an orientation training right now. And we have them recorded. So you can watch a recorded one, or you can come to a live one, and the links are there. The third step is to complete the training. And those of you, we have the University of Maryland online training platform. There are four modules for you to complete.
5
modules. And the key is getting into the online platform. And if you've had any difficulty whatsoever, we've been holding open house during the week to help people. And today, Sebastian's going to open up a breakout room, and you can literally get on board tonight. Step number 4, host a vaccine event. This is key, especially for Shea Moisture. When they stepped up with $1 million to help encourage vaccinations, this is one of the steps that they want to see. And so when you have your event, and I know that our friends down in Atlanta took photos of their event today. They have their certificate, and you simply are documenting your event. And then step 5, you upload your certificate to the Shea Moisture site, and they will then take you through the process of receiving your mini grant, your $1,000 mini grant. We have additional details here about how to host an event and how to transform your shop into a vaccine clinic. And here are some examples at Wilson's Image Barbers and Stylists in North Minneapolis. Hey, that's you, Aaron. Nice story in the paper. So we're lifting you up here. We're going to lift all the other barbershops and salons up as they do their events. There's Fatum All Barbershops. Aren't these some amazing names that they give their shops, Mr. Mayor? That's in Las Vegas, Nevada. And if you have any questions whatsoever, the email you send is to hair, H-A-I-R, at umd.edu. HAIR@umd.edu. On this page,
a video of how this is actually done.
And so I'm going to take you there right now so you can actually see the transformation of a shop into a clinic. Cross your fingers out there.
Well,
okay. Is that full screen, Mr. Omar?
Full screen.
Okay, here we go. Adjust your sound, people.
welcome to Shots at the Shop, and today we're at Katrina's Trey Shades Hair Studio in Capitol Heights, Maryland, which has been amazing.
My favorite part is saving lives, seeing people get vaccinated, because a lot of people are hesitant to get vaccinated. So if I can advocate and encourage them, I'm excited to do so.
A lot of people just don't trust the system. So we have to take the time to answer their questions. And what better place to do that than in a place they already trust?
they can dispel some myths and misinformation that's out there, and then they can refer them to others with more specific questions.
I've honestly seen about 25 to 30 of my clients go from, no, I'm not getting that vaccine, to sure, I'll get vaccinated or show up at your clinic on Monday.
I got my vaccination. I was comfortable with coming here. I actually feel comfortable here than I would at a normal clinic.
I like it because I know this place is not like it's not strange or anything.
You truly are, barbers and stylists, a trusted voice in the community, and we want to tap into your expertise and be a good community partner.
It's just for us to be knowledgeable in these health disparities so that we can have conversations behind our chair, because I believe that we're more than just a hairstylist. We're touching people just like doctors and nurses do.
Any barbershop that wants to hold a vaccine clinic in their place of business will find you a clinical partner.
So we can bring in all the clinical expertise.
I say just do it. Just work on saving lives, keep advocating for the community, bringing more people in, and I do believe that having a vaccine clinic at a salon is well worth it.
It worked here at Trey Shades, and it could work in your barbershop or beauty salon as well.
Yes, son, you're fully vaccinated. It was a great day.
All right. Let's give her some snaps.
Absolutely.
Amazing. And we did a clinic with youth. And you know what was so interesting, Superintendent Blair? Parents came with their kids. Grandparents came with their grandkids. And they're taking photos like it's a birthday party because they were so excited. Now, when else do you come to a clinic or a medical procedure and take photos of yourselves? Okay. So that's why the barbershop and the salon, it was just more comfortable for them. And as Omar mentioned, the importance of coming back, because for the youth, it's the Pfizer 2-shot. Every single one of the 15 young people who got their first jab came back on the second jab. And so they're now asking, hey, when's the next one so I can bring my friends? So we're going to continue to do this. And we wanted all of you out there to see how Katrina turned her salon into a vaccine clinic. And we have other videos, step-by-step guides about how to do that, and then to connect you with a clinical partner. And just as Andre, whatever he ran into, we will knock those walls down. And what happens is now you have a different relationship with your local health department. Hey, Kim, a different relationship with the community, one that can be sustained, because these businesses have been around a long time and they're not going anywhere. So Sebastian is ready to help Omar, anybody who needs to get onboarded, and he's going to open up a breakout room so that they can go to the breakout room and deal with the technology. And we'll continue here to answer questions that are in the chat.
Yeah. Yeah, but what I want to do is bring Sebastian up.
Come on, Sebastian.
Hang out with us for a second. Bring him up for a second.
Put your spotlight on. Meg, put a spotlight on Sebastian.
Yeah, and Sebastian, kind of tell people one who you are, and then tell them what you do as you walk people through, because I want the people who are here to know about you and what you do. You are very important to what we do.
Definitely. Well, my name is Sebastian Godoy, and I attend the University of Maryland. I'm getting my master's in public health and health policy. And so I'm going to take people through how to enroll in the class in a step-by-step kind of way. It does not matter if you're computer savvy or if it's just the type of thing that you're not super comfortable with. I have made a process that's easy and that can be followed along. So I'll help people make an associate account, enroll in the class, and then I'll be giving a sort of overview of how the modules work. And I can help out with any technical questions.
All right. Thanks so much, Sebastian.
So Omar, we still have, we're at 8:09, 8:10. So we were thinking that we would have people go to a breakout room with Sebastian, and he can work on the technology with them. In the past, we've done it as a whole, everybody all together. What's your preference? What are you thinking?
Well, Sebastian, how long does it take you to do this? Because it's a couple more questions. Ms. Gomez, I really want to figure out some strategies for getting our young people involved. So I want to talk some strategy, right? But how long will it take you to walk them through? Because I want the people to see what you do.
Definitely. I can probably do it in under 15 minutes.
Okay. Well, why don't we do this? Stay where we are, and we'll do that all together. All right.
Okay.
All right. Okay. But let's talk about some strategies. We talked about the athletics. Aaron mentioned that the players are making the appeal. But Dr. Blair, you said that there's some people who may not like that because of the economics. Well, if somebody catches, if you become a super spreader event, right, then it's going to shut you down anyway, right? Is that correct, Dr. Blair? Unmute.
Okay, sorry about that. Okay. Yes, there is. We definitely know that, hey, it takes one person, and if it becomes at that event, and that super spreader event, it does shut us down, which is, what happened throughout our athletic season, and I said before, we had some events with no fans because of that.
Right. So I mean, so when a person say that, we trying to make money, well, the best way to make money is to have a safe environment, right?
Totally agree. 100%.
Right. And so that's the thing we want to do. Going into these colleges, Ms. Gomez, how can you use, because you're doing something else, but how can you leverage this method and it does not interfere with your messaging and with because you have clients who have their agenda, right? How can you incorporate that, or you see any synergy around that?
Yeah, I mean, I think it's just a piggyback off of what we already do. We're on the campuses and we have the attention of the students. And we often, can get and keep their attention because we're typically giving away free things. So it could be, a call to action is, hey, you got to sign up for this, some type of, email list that gets them sucked into some kind of funnel that encourages them to get the vaccine. But I mean, there's tons of different ways, but I think just piggybacking it on something that we already do. I know you mentioned, there's lots of literature and things that we could give out, but we also have campus brand ambassadors. So as we were talking about earlier, the peer pressure, I think that it would be really great if we had maybe ambassadors that were vaccinated, that were solely devoted to that cause. Maybe they have, some kind of fun shirt that says, the campaigns that we've come up with, and, they're having conversations with their friends. And when you see your roommates and your sorority sisters and everybody else is kind of identified in a shirt or something that they have a label on them to say, hey, she got vaccinated. I think that it naturally, will render some peer pressure happening. And then I think that we will see positive results in people, getting vaccinated.
I think that's powerful. I just know that if we do it right, we can improve what we're doing. But we got to think out of the box, and we need. That's another thing. We're bringing in new voices, right? Because people need to see different people. If they see the same people, then all of a sudden they say, "Oh, you got an agenda." But when they start seeing different people, like all of you, I think with the exception of Sebastian, Dr. T, and myself, everybody is new to this platform, right? For this time. And so that's good. So we're rotating people in and out so that they can hear from different people. And that's critically important. Now, are there anything, because Ms. Barrow, Alabama is not doing very well, right?
That's correct.
Tell us what your what are you all doing to try to turn that around?
Well, we of course were engaged with the month of action, the White House month of action with regard to the vaccination. So we decided we would think outside of the box a little bit and partner with some non-traditional partners. So we reached out to, one effort was reaching out to our HBCUs and supporting their efforts with vaccine events. We had Stillman College, we had Talladega College, and they had various ways of doing their activities. Talladega College had a blues concert, and they had food trucks made available at that time. We partnered with the governor's office of Minority Affairs. They were able to provide the food trucks where the participants were able to get free food. And the vaccines, the nurses were there with the vaccines. So, that's something that we're looking to do with Alabama State University for the fall, is to have a huge event. And we want to include the fraternities, the sororities, the football players, cheerleaders, band members, and just make it something big. Of course, we know that the director of the health center probably has a vaccination plan for the students, but we wanted to open this up for the entire community. We've reached out to Omega Psi Phi Fraternity Incorporated, the graduate chapter, or one of the graduate chapters here. They will be hosting listening sessions. They will invite the public out. They are partnering with one of the fraternity brothers who's an owner of a restaurant. It turns into a somewhat of a nightclub on Fridays. They have young people there. The age group is 18 to about 40, which is a target population that we're trying to reach. And he's agreed to host a vaccine event as well. We find that sometimes with the youth, and somebody chime in on this, but we find that sometimes if you have incentives, free things that they can get, gift cards, and you couple that with music, a DJ, and some food, and their peers.
Got a party now, huh?
There
Absolutely,
you go.
absolutely. And sometimes it doesn't require, these big time artists. Sometimes you can get local artists to come in, but my girls, I ask them quite often, what would bring you to an event? What is something that would draw you? And they say, give us a good DJ, and we're there. So these are things that we're planning currently at the health department. Of course, we also have to look at our population, people with disabilities. That's another population that we are very concerned about. And so whenever we host any, or if we support any effort, we make sure that the site is accessible. So that the people with disabilities or functional and access needs will feel comfortable going there as well. So, we're trying different approaches. We're doing different things. We know for a fact that, having listening sessions to find out, what are your concerns? Let's talk about this. And we couple that with, okay, once we find out what the concerns are, then we can move to a place of a vaccination event. So that's the approach that we've been taking so far. We're looking to partner with the housing authority as well. That's something that, showing up in the apartment complexes, that has helped quite a bit. And so, we're open for anything.
Right.
We just, we're just out here. We're out here and we won't stop. We cannot stop. Of course, we are fatigued as well because, it's been going on for a long time. but we are committed. We're committed to stay in the course.
Congratulations.
You know, there was a
Congratulations.
saying with the Negro College Fund, United Negro College Fund. It says, "Wouldn't you like to feel another shoulder at the wheel?" Right? And so that's why Impressions of Beauty, people who are already there need to partner with, you know, like the Alabama Public Health. And, you know, Ms. Gomez, I'm sure that you all have some connection with HBCUs in Alabama too, right?
Yeah, I was just gonna say Alabama State. We had a conversation. Omari, I know she's on. We just talked to Ms. Kennedy there in the Office of Student Activities this week, so we're planning some stuff there. So if you want to partner on that, Felicia, we can definitely have a conversation because we have a really great relationship there, and we also have a lot of, like I said, campus ambassadors. So that is one of our favorite campuses to go to for sure. We also have a relationship with the grad chapter of Alpha Kappa Alpha Sorority Incorporated there as well. If you wanted to bring in a sorority or a grad chapter sorority, I think that, you know, we could be instrumental there as well. Mayor Neal, I know that you, I mentioned to you that I have another event that I'm managing tonight.
Right.
So go ahead.
And I just wanted to let you know that I appreciate your time. I didn't expect that you would be this long. But I didn't want to let you leave me. So but we appreciate you so much.
Absolutely.
Miss Ashley Gomez. I mean, we appreciate you so much in Impressions of Beauty. We really appreciate the work that you do. So you can say your final statement.
Yeah, I was just going to say thank you so much for having me. This was awesome. This fell on a night that I had another engagement, but I didn't want to miss this. But I just want to say thank you for having me, you and Dr. T, as I see you're called. Thank you so much for the invitation. And I look forward to working with both of you and everybody on this panel to helping to move the needle forward with the nation on this major effort. So
thank you.
We'll be in touch for sure. And good luck to everybody in their respective efforts.
Thank you.
Thank you so very much.
Thank you.
You know, you add Miss Gomez and Miss Barrow, and all of a sudden we have those fraternities and sororities coming up with the pandemic steps. You know, something unique coming through this historical period. Back in 1918, they had pandemic operas and other theatrical events to document that period. 50 years from now, they'll talk about what we're going through right now. So yes, let those fraternities and sorority sisters and brothers come up with some creative ways that we remember what we are surviving here.
Absolutely.
Thanks so much. And I appreciate you so much.
Okay. Thank you.
All right, Sebastian, you got the power.
Okay, perfect. Sebastian, you're going to have to do one of your truncated versions and then let people know that we'll do some open houses that will take more time with them, but you can at least demystify the process.
Definitely. What I think I'll go over more than anything is how to make an account and enroll in the class. And then I can go more in detail in the open houses about how to navigate the modules.
Okay.
Perfect. So if everyone will just look in the chat, I just put a link, and that is the starting point from where I start. I'm going to begin my training. So if everyone clicks that link, you would see an image that looks like this. It'll say Open Learning here at the top and the University of Maryland right above that. And you'll see a few of the panelists from other webinars, and it'll be titled COVID-19 Rapid Response Training for Barbers and Stylists. I'm going to walk everyone through how to enroll in the class. Just a quick heads up, make sure that you're using Google Chrome. So you don't want to use things like Safari or Internet Explorer because it tends to make everything crash. Instead, use Google Chrome. So if you're on Google Chrome and you have clicked this link, the first thing you need to do is click this blue button that says Enroll. It'll take you to a page that looks like this, where the very first thing that we need to do is create an account. And the way we do that is by clicking on this highlighted bit of blue text that says Create an Associate Account. Once you click on that, you'll see this page where it says an Associate Account Registration. And you'll be asked to give your first name, your last name, email. You'll put in the exact same email underneath, and then a good phone number to contact you. After you filled in all that information, you just click this black button that says Submit. And once you've done that, you'll be prompted with this page. For this training, I just went ahead and used my email, but you'll see your email right up here. So 2 things that you need to do on this page before you can move forward is there will be a box that says yes or no. You need to click yes to agree to the acceptable use of information technology resources. After you've done that, you'll go ahead and click accept. Once you click accept, you can jump to your email and you'll see in an email from an account that says the associate activation non-reply at umd.edu. This will have a link at the bottom of the email, like that'll look a little like this, again in highlighted blue text. You can go ahead and click that link and it'll take you to a page that looks very similar to the other ones we've just had, where it has the University of Maryland logo up top. And here, this is the opportunity where we set up our password. So you input your password in these 2 boxes. It'll be the exact same password every time. And just a little heads up onto password requirements. So it has to be a bare minimum of 8 characters, but no more than 32. And within the password, it has to have an uppercase alphabet letter. It has to have a lowercase letter. It has to have a number and a special character. So a special character in this case looks something like a star symbol or an exclamation point or a percentage sign. So once you've made a password, be sure to remember it. What I recommend is just putting it in the notes section of your phone, so it's easy access in case you ever forget it. So you will put the password here that is a bare minimum of 8 characters, the exact same one below. And then once you put both passwords in, you'll go ahead and click update password. You'll be prompted with this green banner underneath associate account registration. And that means that you were successfully able to make an account. So we will see this page or this banner on a separate page. So we need to navigate back to the prior tab that'll look a little like this. So we'll click on that. And then we'll see this page again. And since now we have made an associate account, we'll go ahead and sign in to this page. And the way we do that is right below create an associate account, we'll see the text, again, highlighted in blue, sign in here. You'll click that text and it'll take you to a page that looks like this, where it says directory ID right here. You'll go ahead and put the email that you use to make your associate account. And underneath that is the password that I asked everyone to write down in their notes section of their phones. Once you've put in both the email address and your password, you'll go ahead and click this red button that says login. And from here, there are 2 last things you need to do to enroll in the class. One is there will be an empty box here. You need to make sure to check it. It says, I'm not a robot right beside it. And after you've checked that box, you go ahead and click the blue button that says enroll in course. From here, you'll get another email, again from the University of Maryland, saying that you are enrolled. And at the very bottom, it says access your dashboard. So once you click that blue button, it takes you again to the open learning page. And then these are all the courses that we're enrolled in. So at this point, we have all made an associate account and we have all enrolled in the class. And so in order to begin the class, we would click this blue button here that says begin course. If Open Learning ever asks you to sign in, it is just the sign in info that we registered prior. And that is how to make an associate account and enroll in the class. And like Dr. T said, we'll be hosting open houses next week where I'll give the exact same training and I'll go give an overview of the modules as well. Additionally, I'm going to stop sharing, but there is a YouTube video of this exact same training on our Shots at the Shop page, and I'll go ahead and drop that link in the chat before we wrap up the orientation. But that's about everything that I have. And the last little thing, Meg just dropped in our chat that if you ever have questions or want someone to go through this with you, please email hair@umd.edu. That's a great resource in case you ever have questions or concerns. Thank you.
All right.
So I wanted to say this, Omar, those steps, it's for our security. there are organized groups out there trying to do just the opposite of what we're trying to do. And so this is why these platforms, we're not getting Zoom bombed. You won't have your class crash. And so it's for creating a secure space for us to learn together. But once you're over that, what an opportunity for us to get all on the same page and row in the same direction to beat this virus. Omar, how time flies, brother.
Absolutely. So what I want to do is I just want the panelists to give us a just takeaway, and then we're gonna end this thing. I never like to end things when I'm in so, but we do know that we have to. So good things must come to an end as well. So let's go with you, Dr. Blair. Let's start with the takeaway. What do you want to share with us, your family, as we begin to part today?
I want to thank you first for the opportunity, and to say to our barbers and stylists, thank you for taking this opportunity to learn. And as I approach, August 6th, my staff returns, and on August the 9th, our students return. We need all of our students and staff in school. We need them face to face. A lot of our students were not very successful. Our staff, they were not very successful at the remote hybrid as learners themselves. So we need everyone back. So I'm just encouraging all of the stylists and barbers, let's get on board and give a positive message. Sign up, you get the clinic, whatever we can do, because we need students in school. Our children depend on this education so that they can be successful. We're depending on them so that we have a great future. And I need as many of my children back in school on August the 9th. So, and I know a lot of superintendents across the country are asking for the same. And I do not want this variant or whatever's happening in our community to spread. I'm in a rural area, so we had a desperate impact of it because we have a lot of essential workers, and we do not need a repeat of what's happened in our communities and in our urban or even any other environment. So I'm just encouraging everyone, let's get on board and give this positive message and get as many people vaccinated as possible. So just for me as an educator, we can keep educating our babies. Our scholars need us.
Thank you so very much.
Thank you. Thank you.
But Dr. Winston, your takeaway, what do you want to leave the barbers and stylists with, and all of us?
I want to reiterate what Superintendent Blair said. Our kids need to be back in school. We know that children develop in a multitude of different ways, and it is not purely academic. They need direct instruction. They need interaction with each other. They need the emotional support, psychological support, and physical support of schools. The only way that we can look at the overall general health of children is to get the ones vaccinated that are eligible and get them safely back into school setting. The other thing I want to emphasize too is that this is not over. It is not over. I get that, that vibe from my patients' families. Everybody's out and about. We're seeing so many more your typical childhood illnesses, but we're also starting to see the COVID cases trickle back in. We went, maybe a month or so with no cases in my office, and now we're starting to see that trickle coming back in. So, I'm afraid that as we do, continue to try to, we've loosened that, let our guard down. Mm-hmm. And as we do get our kids back into the schools, we're going to see these numbers just resurge in a way that we may not be able to respond to, and may find ourselves back in the same situation we were 6 or 8 months ago. So, for our barbers and stylists, if you can continue to be a support system and a vehicle of information and a vehicle through which, we can get more shots in arms, the medical field would be much appreciative.
Good. Thanks.
Thank you.
Dina Winston, who is, I call her my pediatrician. For my daughter. I know Omari is good.
Omari will always be one of mine. She will always be one of mine.
Absolutely. But Ms. Felicia Salary Barrow, what's your takeaway?
I thank you again for this, the chance to come on and listen to all the voices here, our partners in health. We appreciate all of you. But with the Department of Public Health, we want everybody to know, we want our barbers, we want our salons, our stylists to know that we're here. We want to partner with you. We want to help you in this, in the effort of protecting the public. So reach out to your local health departments. You know, even if it's a county health department, reach out. We want to support your efforts. And just echoing what everyone else has said, you know, talk to your clients. You know, you're a trusted voice for them. Talk to them, continue to encourage them if they have not been vaccinated. And for those who have been vaccinated, you know, y'all need to have a good old party. But you know, we know that you know, staff at Public Health, we are going to be as patient as we need to be. We know that moving this needle is going to take some time. We understand that. So we're going to keep talking. We're going to keep partnering. And we just look forward to any engagement that you would like to have with us. So thank you again for this chance. And I might also add that my two girls were patients of Dr. Winston. And the youngest is now a freshman in college. So it seems like just yesterday.
I thought so. I was
Just love it.
putting that together a minute ago.
Good.
Talk about relationships and trust.
Kim,
absolutely.
Are you still there? I'm not seeing you on camera, but if you can make a comment or a statement if you're still with us. I know a lot of people are moving around doing things. Certainly want to be able to give you that opportunity.
And we're right at that witching hour.
Right. Well, Dr. T, I'm gonna let you say what you're gonna say, and then I'll take it on.
Well, you know what? This was a very interesting evening because we're focused on children, and you know, my hat goes off. My hat is tipped to the pediatricians out there. The relationships you have with the parents, and then the children that you bring into the world, and your commitment to save their lives. And Superintendent Blair, what a yeoman's job to take care of those kids when they come back to school, make sure they're healthy and safe. And you know, you can't keep them safe all the time, and you want the neighborhoods that they're in to be safe as well. So my take home comes from the word cloud, Mr. Mayor: motivated and encouraged. That's what this night did for me. I am motivated and encouraged. We brought some new voices to the Hollywood Squares. We had 56 folk in the big room tonight. We had some folks who've been here before, from Andre to Aaron Perry, who have done events in their community. We're going to highlight these best practices so that they can share how they're getting this done. And know that we're going to be there for you to break down any walls or barriers you encounter to getting access to a clinical partner to give vaccines. So Omar, take us home, brother.
Well, I want to say a few things. One is I want to share this with you. This went to every household in the state of Alabama. And we are trying to really be robust in getting the message out. If you notice, I'm right here, being a descendant of a person who was a part of the United States public health study that was conducted in Tuskegee. My uncle, Freddie Lee Tyson, was a part of that study. He was a not participant, but he was I would call a victim of that study. And then I looked in this week, Montgomery Advertiser, and on the front page, here I am again talking about getting vaccinated. I believe that everyone has a charge to keep. And when I was growing up, we used to sing a song, "There's a charge to keep I have, and a God to glorify, and every dying soul to save, to fit him for the sky. To serve this present age, my calling to fulfill, may it all my power engage to do my master's will." And I believe that we all have been called out to be called on for such a time as this. Barbers and stylists, we have a special relationship with the community. We need to leverage that. Booker T. Washington said we need to cast down the bucket window. And so we've come to you, our trusted information centers, our barbershops and our salons, to say, help us to save our own lives. As always, I'd like to leave you with these two words. Remember that I love you with a perfect love. But more importantly, remember this: you got the power. Thank you all for sharing.
All right, you got the power.
Bye-bye.
Snap them home. Hey, folks, don't play with Delta. Keep your mask close.
Absolutely.
Sanitize.
Absolutely. Take care. Thank you all so much, Dr. Winston.
Thank you.
Carol, Dr. Blair. Thank you all so much.
It was an honor meeting my friends from Alabama.
Absolutely.
Thank you for coming on tonight.
Thank you all so much.
Same here. Pleasure, Dr. T. Doctor, you all have a great evening.
Take care.
Bye-bye.